Hi, this is Mary Cupp, and this is my population level health education intervention program for nursing 447. Introduction. The four health related problems that I discovered for the Buena Park area 90621 was a substance abuse for the homeless, increased risk of infection, overnutrition, particularly malnutrition, and pulmonary disease, chronic obstructive pulmonary disease. Background and significance. Substance abuse is both caused and a result of homelessness. According to the National Coalition for the Homeless in 2009, 38% of homeless people were dependent on alcohol and 26% abuse other drugs. I also figured that risk for infection is high among the homeless population because they often lack the resources and means for proper hygiene. Nutrition is also a problem for this population. With nutrition and meal intake, there's always uncertainty of when the next meal will be and the quality of the meal. In 2015, 12.7%, 15.8 million households are food insecure. 5% of the U.S. household, 6.3 million households had very low food security, according to the United States Department of Agriculture. Smoking is also a bit of a struggle for the homelessness, according to the National Coalition for the Homeless. The prevalence of smoking is more than 3 times higher among homeless than in the general population. Healthy People 2020 objectives that I targeted for this populations are reduce substance abuse to protect the health, safety, and quality of life for all, especially children. Prevent, reduce, ultimately eliminate healthcare associated infections. This one wasn't quite geared to the homeless population, but definitely infection is prevalent among the homeless people population. Promotion of health and reduce chronic disease risk through the consumption of healthful diets and achievement and maintenance of healthy body weight. Also, to reduce cigarette smoking by adults. Needs assessment. Both of the population stakeholders and the key stakeholders identified homelessness as being a problem or a key factor in the Buena Park area. One of my key stakeholders is Melody. She's the community relations personnel for the Salvation Army. She had stated that drug abuse was a problem among the homelessness. And Sue Lynn, Development Associate for Giving Children Hope, identified obesity was a problem for children in the community that she serves. And there was also Alan. He stated that he's the head of the security for Southern Baptist Church. He said meal intakes were always difficult. The church only provides 2 meals a day, breakfast and dinner. And they also hold Alcohols Anonymous every Wednesday evenings after their supper. Theoretical framework and needs assessment. The pre-seed-proceed model helped me in identifying developing an educational plan for this for the course in nutrition, as well as COPD and smoking. The model guided my project in formulating smoking and education interventions. Kind of a question that I asked myself going through the pre-seed proceed model was, what teachings can I provide to this population that they would most benefit from? And I thought my teaching can focus on not only the available resources for food and good nutrition, but also introduce the food plate and a social determinant of health. Being part of the homeless population, generally have a difficult time in managing chronic illnesses due to low health literacy. Barriers for this population was lack of financial means, possibly low health literacy, motivation, and lack of support and transportation. An asset that they have for this population is some local community resources. There were a few support groups that I found for smoking cessation and a few free clinics nearby. Interventions, nutritional resources. I discussed in this topic why nutrition is important, how to achieve proper nutrition, challenges for the underserved, which was transportation was a big issue, and financial resources. And the biggest thing that I think helped them was providing a list of resources such as soup kitchens and free clinics. For COPD, the smoking cessation, what is COPD, pathologies, precautionary measures, treatments, and smoking cessation. I provided a list of free clinics and free support groups for this group. Budget-wise, it was minimal cost. My personal transportation was really the big issue. Personnel at the shelter was unpaid, and they were all volunteers. Well, kind of a barrier that I had was before my presentation, I met up with a stakeholder and said, hey, do you happen to have like a projector for a PowerPoint presentation? And at that time he said yes. And when I came to do my teaching, I had no PowerPoint, so I just went off of my my laptop. That made teaching kind of hard. Project evaluation and outcome measurements. The goal and objective was for my teaching was to verbalize, for the population to verbalize other resources and locations of places to achieve and obtain free balanced meals appropriate for nutrition and body requirements. A goal for my COPD teaching was to verbalize understanding of risk for communication of smoking habits and verbalize benefits of smoking cessation. Measurement for success or failure, express importance of well-balanced diet, utilize other resources available to fill in meal gaps. The population education to also verbalize barriers to quit smoking and other resources to utilize for better support system. In order to change the behaviors, support groups need to be easily accessible. Clinics and other resources need to be provided as well. Necessary interventions to affect change of behavior for this population are legislative policies and more clinics for educational classes. Excuse me, results and conclusion. My intervention was done November 29th during mealtime after dinner. It was a Wednesday. I noticed that many resources were not as local to the population as the population would like. Some of the resources in soup kitchens were Newport Beach and Santa Ana, Costa Mesa, kind of far. I did have one comment about the nutrition, that they'd rather be given money instead of free food. And then another person was highly interested in where the soup kitchen was in Costa Mesa. Suggestion for my CUPD project, I think at the beginning I will definitely stress that my teaching wasn't intended to make them change their lives. I had someone say, don't tell me how to live my life and tell me not how to smoke. But I stress I'm not there to change their lives or tell them how to live their life, but to give them the knowledge and resources for them when they are ready to quit smoking. Thank you very much. I really enjoyed this project. Have a nice day.